My name is Anand. I'm an occupational therapist, acupuncturist, and a naturopath. I trained about 25 years ago, and over the years I have studied different aspects of complementary medicine like yoga, meditation, shivambu, and lots of other natural therapy techniques. Today I'm incorporating all these bits of information for the benefit of my viewers and listeners to help them get an insight into how to get to better health. Shivambu and how it should be used by most of us in our day-to-day life. I will break it down into three categories again: shivambu for preventive, shivambu for curative, and shivambu for therapeutic use. For preventive health, any one of us can drink our urine first thing in the morning. First thing is considered after 3 a.m. So if you get up in the morning anytime after 3, you collect your urine, you collect the whole lot, preferably in a glass or stainless steel or gold, silver containers, and drink all of it. That's all one needs to do. Over time, you will find that the therapeutic benefit will start. For curative, when somebody has got an illness, you must talk to somebody to get some guidance. The reason being, it is imperative that the correct dosage of shivambu be prescribed within the capacity of the body to handle it, and also within the capacity of the body to try to get rid of the disease process and help the body revert back to its healthy, balanced state. And therapeutic is where there is a complicated condition where you have to be under the guidance of somebody who practices shivambu, who is experienced in it, and who can guide you step by step. At this stage, let me take a case history of a person who had a kidney stone. This was a young gentleman in his teens who was studying very hard, working about maybe 19, 20 hours a day. And one fine day found himself passing urine and having blood in the urine. Besides, of course, there was immense pain. He had a test, X-ray, which showed that there was a rice grain type crystal stone, kidney stone, in the kidneys, and that was the cause of his colic or agonizing pain. When the gentleman discussed it with me and we talked about possibilities, I suggested shivambu may help, and we put him on a regime of shivambu 24/7. Drink whatever urine you pass all day, add plenty of water, and add some barley water as well. Within 24 hours, his pain had eased. Within 48 hours, his bleeding had stopped and pain had nearly disappeared. The person continued to take shivambu for nearly a few weeks, and about 2 weeks into the course of treatment, he went and had another X-ray, only to reveal that there was no kidney stone. And of course, the patient from day 2 has been a lot better in health, no pain, and slowly recovering. When one looks at such cheap, effective remedies, shivambu definitely is top of the peak, because shivambu does not cost anything. It's only the cost of the advisor, whatever that might be, the consultant. Now, what are the things one needs to do when one needs to practice shivambu? Shivambu practice consists of internal and external use. Let's focus on internal use. Shivambu internal use. When one practices shivambu, internally means one needs to drink. Enema is also another internal use, but I will make reference more to drinking urine. Drinking urine, as I said earlier, should be first thing in the morning, anytime after 3 a.m. But when we start looking at complex cases, a specific prescription will be required to tailor make it to the health of the person and their ability to tolerate it. Shivambu has an ability to start cleansing the body, and as part of that, it does it well. But sometimes, when it is doing it well, it can be overbearing for the body to handle. I was earlier referring to a couple of different theories. I referred to the biofeedback theory. I was talking about the eliminating theory. The eliminating theory talks about getting rid of toxins from the body through the skin, through the bowels, through vomiting if required, sometimes through the eyes, etc. And it basically cleanses the whole body thoroughly over time, thus making ourselves a lot healthier and performing better. I have a nutritive theory where I believe shivambu is the fastest food around. We talk about fast food. The reason I say that is when we drink shivambu, the ingredients in shivambu are identical to the ones in the blood. Shivambu is supposed to be sterile, and as part of that sterile process, the ingredients in urine and blood match up. Urine is a component of blood which at that point in time is excess in the body. So for example, if I was to eat a lot of salt, my urine is likely to be very salty. If I was to eat a lot of sugary foods, there is a possibility that the urine will have a lot more sugar breakdown products. If I was to eat a lot of spicy food, there is a possibility my urine will tend to be a little bit hot or pungent to that effect. Now, everything that is excess at that point in time in the blood is filtrated, eventually to be sent into urine. One of the things we forget is our body produces close to about more than 160 liters of urine a day at the rate of filtration from the kidneys. And most of it is reabsorbed. We actually pass only a couple of liters of urine every day. So, the body is already reabsorbing a lot of those ingredients because they are useful. When we ingest it with a drink of urine, one of the benefits is the stomach, the intestines do not have to do a lot of work in breaking down food items into the micro ingredients, into small amino acids to be absorbed into the blood. The urine, having all the ingredients there in a ready-made format, can go straight into the blood and thus save the body a lot of heartache in terms of digestive energy. That's why I refer to it as fast food. The other thing I find in the nutritive theory is that as part of the cleansing process with urine, urea being a hygroscopic element, one of the things that tends to happen with urea in the body is absorbs water. So the whole gut is cleansed from within like a shower because the urea in the urine pulls the fluid or liquid from the intestines, thus cleansing the villi, the intestinal lining, the gut lining all the way, and hence making it cleaner and better for absorption of food and ingredients that we might follow through with eating and digestion. Talking about internal, based on the severity of the condition, there are fasts where people go on a shivambu fast for a few days at a time, or they go on special diets of juices and herbs. But I would recommend that to be under prescription after guidance from someone who knows about shivambu and health. The external use of shivambu. External use of shivambu has got multiple uses. You can use fresh urine to cleanse the eyes, the ears. You can use it as a mouthwash. Aged urine can be used for skin to improve skin conditions or maintain your general skin health. Obviously, you don't just apply that and leave it. You apply the aged urine, aged at least 3 months old, and apply it to the body, and then let it sit, preferably in the sun, for about half an hour. And then have a shower and wash yourself, but preferably with only water or basin, or what we call as split pea flour. We do not recommend soap because it cuts through the system. It cuts through the skin a bit harshly. We have found this quite useful for skin conditions. It has also been used for healing wounds for some people, but these are all anecdotal evidences. Let me throw in a case history here that might be of interest. A young patient comes to me after years of frustration by the parents because the child is just scratching and scratching and scratching, and the only treatment that has been offered is allopathic treatment, which is useful but very short-term benefit. What do I mean by that? The patient has been given some creams, and every time the creams are applied for up to 6 to 8 hours, the patient is free of itching. Like clockwork, around the 8 to 9 hour mark, the itching starts if another round of application has not been done. This had been going on for years, and the child was frustrated, the family was frustrated. And when they came to me, we looked at it and we thought, oh yes, shivambu may have an answer. We didn't know at that time that it was a guaranteed cure. And initially we applied aged urine to the skin. And lo and behold, within as much as a couple of weeks, the skin started improving. The child started sleeping better. And then once we knew that this was benefiting the patient, we then recommended drinking urine. And even though the patient was reluctant to do so due to age and feeling obnoxious, when the patient realized that it is well worth it, patient agreed, parents agreed, and within a period of 6 months to a year, the complete itchy illness was gone. The child started developing more normally, grew up better, and now when I have checked the case a few years down the track, patient is hale and hearty and does not need shivambu. So it's not a case of once somebody is on shivambu, they have to have it for life. It is obviously something that they need to do, and once they are cured, they may be able to get off and have a normal life without having to resort to any treatment or therapeutic input. Who should and who should not take shivambu? Most people can take shivambu internally without any problems. The few people who I recommend should not are people who have had polio, who may have had some hernias, because with frequent use of shivambu, your ligaments and muscles tend to become a little bit more flexible. And for those patients, you may find that excessive flexibility may be a disadvantage. Elderly should be careful, the very young should be careful. All adults can take shivambu regularly. Women should not take shivambu during their period cycle. They should wait for 2 to 3 clear days before they can partake of shivambu. All adults should not take shivambu straight after intercourse. They must pass their urine and clear the tract and then collect the urine, and that is okay. These are some of the prescriptions. Of course, people who have got different illnesses must make it a point to check with their doctor or consult somebody who understands the depth of shivambu and its scope and how to cater to their individual needs. Having looked at all the basic details of how shivambu can be utilized with external and internal use, some of the therapeutic benefits through case histories, and an insight into the scope of shivambu, I feel it's more than enough at this point in time for you to consider options of practicing shivambu if you wish to. If for any reason you wish to have more details, you're more than welcome to contact me on my email, and we can try and assist you in your quest for better health. I wish you all the very best. Good luck.